7. I welcome you to our public awareness program on Let's Fight Against Fatty Liver. NASH 24/7 brings in best in class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on the topic today, we have a renowned gastroenterologist, Dr. Amit Thawrani from Gwalior. He needs no introduction. However, I would fail my duty if I don't mention that he is a leading gastro in Gwalior, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He is having decades of experience building a clinical skill set that allows him to deliver patient-centric care. He is currently a consultant gastroenterologist at his own gastro liver clinic and endoscopy center, Dr. Amit Thawrani's gastro liver clinic and endoscopy center, Gwalior. We salute his dedication towards spreading awareness related to liver health and disease. So without taking further time, I now invite Dr. Amit sir to enlighten us on the topic. Over to you, sir.
Good afternoon. Thank you for giving me the opportunity for this educational program. We are today will be speaking about fatty liver disease, the NAFLD. Recently, it has undergone modification in terms of nomenclature, but to keep things simple in terms of perspective to the general public, we'll be referring it to as fatty liver. So, fighting fatty liver disease. Hello.
Yes, sir. Audible.
The slide is not moving actually. Yeah. As we see, the liver is the second largest organ in the body, which is weighing at an average of about 1.5 kilograms with 5% fat. And it's located in right upper hand of the abdomen cavity on top of the stomach and intestines. It is pinkish brown in color, soft in consistency, and is highly vascular. Next, please. So, to things proper put into perspective, once we put the things about the liver, it has got a lot of functions. It does not function just only in adulthood. It starts functioning when the person is in the womb. That is, he is in the fetus. So it produces bile, regulates blood composition, processes nutrients, and it destroys RBCs. In fact, it produces RBCs in prenatal period also. It in some condition of blood disorders, it degrades the blood also. And the breakdown of alcohol in medications, that is known as the first pass metabolism. Whatever medications we take, they are metabolized through the liver. So liver plays a very important part. Whatever we eat, whatever we drink, whatever we take, it is decontaminated through liver. And it contains some 500 metabolic processes and produces protein, and it helps in metabolism of proteins and cholesterol also. Next. So, non-alcoholic fatty liver disease is a condition where fat makes about 5% of the weight, and it is not only caused by alcohol use, and it is because of the obesity and other metabolic conditions. And when it left untreated, it can produce to NASH. NAFLD and NASH are separate terms. We'll discuss about it. So the risk factors being overweight or obese, having type 2 diabetes or high cholesterol, and they are associated with increased chances of NAFLD. Next. So 1 out of 4 people will have NAFLD regardless of the weight. It is well-known fact. Indians are more prone to it. More than 6 diabetes and 9 severe obese patients out of 10 will have NAFLD. And the male gender has been regarded as a risk factor for progression to NASH and fibrosis. Next. So here is a diagram which is showing a healthy liver, and when the fats gets deposited, it converts into the fatty liver. It is known as a first hit, and when the fats get deposited, it causes destruction of the liver parenchyma due to inflammation. The scar tissue formed is because of the liver injury occurring, which is causing liver fibrosis. And the last stage, when the liver is totally damaged and there is a lot of scarring in the whole of the liver, which leads to cirrhosis. Next. So there are two terms known as NFL and NASH. NFL is when fat accumulation accumulates in liver, and NASH is when there is fat accumulation plus inflammation and scarring. So these are the terms where fat accumulation is known as steatosis. Steatosis will lead to inflammation of the hepatic cells, which is known as non-alcoholic steatohepatitis. And scarring of the liver on basis of staging is known as fibrosis. Deposition of fat is known as, which leads to scarring, is known as fibrosis. Next. So what causes NAFLD? The risk factors. First of all, obesity. We should maintain ideal body weight. Genetic background has been shown to cause increased progression of NASH. The food we take, high caloric food, increased fast food, and the kind of food we eat. Physical inactivity, not doing proper physical exercise, being exposed to certain medications which lead to cirrhosis, and metabolic syndrome, where there is a constellation of certain things, which is known as metabolic syndrome. We'll discuss about it. Next. So how obesity and fatty liver disease are related? Today's lifestyle of eating fast food, junk food, leads to overweight, leads to obesity, and that causes the fat to accumulate in liver. And once the obesity, there is an increase the amount of visceral fat. The visceral fat is increased and it gets deposited into the liver also, where it constitutes about 5 to 10% of the weight and leads to scarring of the liver getting damaged ultimately due to deposition of fat. Next. So how NAFLD and diabetes are connected? It is a bidirectional. NAFLD can lead to diabetes and diabetes can lead to NAFLD. There is a threefold risk of death due to cirrhosis in cases of diabetes because of increased risk of NASH. And the patient who have high proportion of diabetes, they have increased risk of non-alcoholic fatty liver disease. There is a phenomenon known as insulin resistance, which promotes fat deposition and it to the liver and leading to liver fibrosis. Next. So what are the NAFLD symptoms? Generally, these are non-specific: increased fatigability. There is a pain in right side of upper abdomen. And generally, when NAFLD progresses to NASH, there are symptoms of deposit. When there are liver gets damaged, other signs and symptoms get developed. This leads to ascites, this leads to pedal edema, which leads to other things. We cannot go into much detail, but symptoms of NASH, when the liver gets damaged, the advanced stages of liver damage, then other signs and symptoms develop. Next. Fatty liver can be silent killer because the progression of disease is very gradual, and diagnosis of NAFLD often involves blood test, ultrasound of fibroscan, liver biopsy, and X-ray or CT scan. Next. The most common blood test we do in routine practice is LFT, which includes SGOT-PT or AST-LT. And persistently elevated ALT can be associated with disease progression. Patient with normal ALT can have progressive liver disease. That is a known fact. In fact, up to 80% of the NAFLD patients have normal ALT. And there is no as a designated ALT cutoff or predictor of NASH or advanced fibrosis in patients of NAFLD. Next. There are some blood tests, various scoring methods, which are known as non-invasive methods of assessing liver fibrosis or which are used in NASH. These are the FIB4 and NFS, and NAFLD fibrosis score. The FIB4 involves age, AST/ALT, and platelet count, and NFS or NAFLD fibrosis scores involves age, AST/ALT, platelet count, BMI, and fasting glucose plus albumin. These are very easy to get it done. You can get it done routinely from the lab. You can assess it. And these are quite accurate in assessing the stages of liver fibrosis. And these are known to be more sensitive than AST/ALT. And there are online tools to calculate these scores. The formula is available. You can do it at your home. You can enter the value of your blood report and generate the score to understand the risk factors. Next. Next slide. Yeah. Other methods of diagnosis, ultrasound, it is commonly available. There is hypoechoic liver when we see on ultrasound, the fatty liver which is appearing, and when it turns cirrhotic, there is nodularity and standing which is seen. The pros is it is easily available, it is economic, and reasons for most accidental diagnosis are NAFLD. You get it done from some non-specific problem, and you will end up that you are having NAFLD or fatty liver. The drawback is that it only detects NAFLD if fat is greater than 25%. The sensitivity is less, and it cannot differentiate between fat and fibrosis. So only you come to know that you are having fat. You cannot stage the NAFLD. Next. The recent advantage we are getting, the recent armamentarium in cases of fatty liver disease is availability of FibroScan. It is known as transient elastography also, based on sounds, the Doppler principle of sound. The probe, which is attached to the stomach, the right hypochondrium, we put the probe, the sound waves are sent to the liver and it comes back, and computer calculates the difference between the sound velocity which is going in which is coming out. So elastography in principle is the measure of the elasticity of the tissue which is lying in between. So that's why it is known as transient elastography. So it can diagnose NAFLD with fat greater than 10%. It can differentiate between fibrosis and fat content. It's a very the pro point, and it is very easily to operate. You can train a technician; he can just get it done. You need not do a special training for that. The other side effect, the cons of this study is that very obese patients who have very thick abdomen, thick fat layer, their results may be misinterpreting. When the patient had developed frank cirrhosis, the result may be misinterpreted at that point of time also. Next. So, as I said, it works on the basis of transient elastography. We get differential values, including LSM, liver stiffness measure, and stiffness LSM measures the degree of fibrosis in the liver, and CAP is controlled attenuation parameter, indicates the degree of steatosis in the liver. Next. Other modality which is available is MRI PDF. MRI is a gold standard to detect fat deposition. It can measure fat content as low as 1%, and it is used for liver donor patients who are donating liver for liver transplant, because we need to accurately stage the amount of liver steatosis, because chances of graft rejection are high if patient has high fat deposition. The con is that it is not widely available. We need a special CT scan. We need a special software to measure it, and it is costly. Next. The last is liver biopsy. It is invasive. We take biopsy through a special biopsy gun from the right upper quadrant from the liver, and it is a gold standard for diagnosis of NASH and NAFLD, and it is the only proven method for diagnosing NASH. It is a gold standard. Whenever you are in doubt, we need to get done the biopsy, and it rules out the other causes of liver disease also. When we are in doubt whether it is pure NASH or some overlap, liver biopsy is needed. The side effect is that it is painful, it is individual dependent, and early stage of NASH may be misleading in terms of histology, and the side effect of injury to the liver or liver hemorrhage due to liver biopsies are there. Next. So as we see the progression from fat deposition, NAFLD to NASH, it takes years. It takes time. Patient progresses from progression is slow from NAFLD to NASH. But it is said that early intervention will always be beneficial when patient has isolated fatty liver disease, and when it progresses to fatty liver with mild inflammation, or NASH cirrhosis or HCC, as the diagram shows, the progression is to NASH and then NASH with cirrhosis. And then some patients will progress to HCC and some will decompensate. So this is the model which has been proposed, that this is the natural history of fatty liver disease. So any intervention which has to be done in early stages provides good results. Next. So we have to act before it's too late. And it is a more, NASH is a more serious form of NAFLD in which you have scarring of the liver, and cirrhosis may lead to liver cancer. We have to remember that. And severe NASH is not reversible. We have to reverse it if we have to act. We have to act in early stages of liver damage where it can be a reversible form. Next. So the interventions which are available are in form of diet. We should take good roughage. We should eat healthy diet in form of balanced diet, low calories, lot of fruits, lot of vegetables. We should do a lot of exercise, at least 5 days in a week. And exercise can be aerobic and or non-aerobic, as we'll discuss. We should have a lifestyle modification. We should drink alcohol in limits which has been prescribed, the safe limit of the alcohol, and we should avoid smoking. And the newer medications which are available, they decrease the liver fibrosis, they decrease the liver fat. We can ask to our practitioners for about that. Next. So first, about controlling our weight, combination of hypocaloric diet and moderate intensity exercise provides best likelihood of sustained weight loss. Weight loss of at least 3 to 5% body weight helps to improve steatosis, and weight loss of 7 to 10% improves majority of the histopathology of NASH, including fibrosis. It is very important to note that we have to control diet and we have to do moderate intensity exercise also. Alone controlling diet or alone doing exercises will not be beneficial. Next. So this is the pyramid which is showing when there is a weight loss, how the things get reversed. First, there is steatosis, then there is malonic inflammation, then is NASH, and then is fibrosis. When there is a weight loss of greater than 10%, fibrosis recedes, and then there is a weight loss of greater than 7%. The ballooning inflammation decreases. And when there is weight loss of 5%, we go for steatosis. Next. So the prescribed diet for healthy liver has been Mediterranean diet, because Mediterranean diet is full of vegetables, antioxidants, and so it contains moderate portion of poultry, eggs, cheese, yogurt. Base your meal around vegetables, fruit, whole wheat grains, olive oil, beans, nuts, legumes, seeds, and herbs and spices. The majority of the portion at the base of pyramid should be of such things, such as vegetables, fruits, whole wheat grains, and red meat and sweet should be less at the top. And seafood and fish can be done in between. And poultry, eggs, cheese, yogurt should be taken in moderation. And red meat and sweets should be less. Next. The types of exercises which are recommended are aerobic and resistance exercises. Aerobic exercise, they reduce liver fat, maintain healthy weight, and improve cardiovascular conditioning. Resistance exercises, they reduce liver inflammation, improves glucose absorption and insulin sensitivity. They improve metabolic parameters with less energy consumption. And as we do regular exercises, fatty liver will improve to normal liver. Next. The lifestyle tips which you should be done to tackle NAFLD or NASH. We should develop a routine exercise regime and stick to it. We should get enough sleep. Sleep is very important. If you don't sleep adequately, it will lead to more counter effects. Get enough vitamins and minerals, regular checkups, eat small and frequent meals, eat 2 to 3 times a day, but small in amount, and lower your sugar intake. Sugar intake has to be reduced. You have to cut down your table sugar which you are taking. Next. The NSL, which is the body, parent body, they have done research. They have endorsed 3 molecules. First is the pioglitazone, and the indication are NASH with or without fibrosis in both diabetic and non-diabetic patients. And minimum duration suggested is for 2 years. Second is saroglitazar, NASH with or without fibrosis in both diabetic and non-diabetic patients. The suggested minimum duration is of 1 year. Vitamin E, which is very old common molecule, it has been used in NASH with or without fibrosis in non-diabetic adults and pediatric patients for a recommended period of 2 years. Next. What are the tips to prevent fatty liver disease? Limit intake of saturated and trans fat. Eat a very balanced diet. Limit consumption of refined carbohydrates. Refined carbohydrates in form of maida, which is used in fast food and all. Maintain a healthy weight. Quit smoking. Exercise regularly. Limit or avoid alcohol. And take medications as prescribed. Next. So we should take a pledge to love our liver, and we should look forward to it that our liver remains healthy, because a lot of patients are overweight and they are developing diabetes, overweight, lipid abnormalities, hypothyroidism. These are all a part of, we can say, metabolic syndrome. So NASH is just a part of it. We should take care of our liver and be healthy. Thanks.
Thank you, sir, for this wonderful talk. This has enlightened us. And now, with your permission, we'll take questions. Sir, the first question is NASH is a hereditary disease?
No, NASH is not hereditary, but insulin sensitivity or diabetes is hereditary. The persons who have parents with a diabetic lineage, they are more prone to develop diabetes, and that may predispose to NASH. NASH as such is not hereditary, but the tendency to develop NASH is there. So patients who have a family history of diabetes should take care of their body weight. They should exercise regularly, and they should follow a healthy lifestyle.
Sir, and what if there are in family there is a fatty liver for years, but no complications so far? So will that the parents both parents are having fatty liver from last 15-20 years? So will that son or a child of that parents would be at risk of fatty liver?
As I told, there are fatty liver disease is a complex phenomena of various things. Genetic susceptibility is there, the environment and the diet and lifestyle the patient follows. It is one of the parameters. But definitely, yes, if the parents are having a tendency to develop fatty liver disease, the child will have increased tendency to develop fatty liver disease, because genes for metabolizing the fat cells or the fat metabolism is deranged in such cases. So he has to take extra precautions so as to not to develop, because if both the parents are more disposed to having fatty liver, the child will have increased tendency to developing fatty liver disease.
So the next question is, what if I'm not obese and have been diagnosed with fatty liver? Will I also need to undergo weight loss or diet restrictions for this patient, sir?
Look, there is a special phenomena in cases of Indian patients, Indian people, where body weight is not much as per the Western guidelines. They are not overweight, but still they are developing NASH. This is known as lean NASH, the specific term which has been coined. And it has been shown that it is due to polymorphism in fat metabolizing genes. So despite of having lean frame, they are developing NAFLD and NASH. So such patients are advised to undergo exercise and lifestyle changes so that they develop at least 5% of the weight loss. This will help in developing, this will take care of the NASH or the NAFLD they developing. Because for them, they are lean as per the Western standard, but for Indian standard, they are overweight. So they have to undergo lifestyle and dietary restrictions so that they decrease their weight and decrease their fatty liver.
सर इसको रिवर्स होने में कितना टाइम लगता है सर फैटी लिवर? और दूसरा सवाल है सर, द दवाई है, हाउ लॉन्ग मेडिसिन फॉर फैटी लिवर शुड कंटिन्यू?
Look, the recommended guidelines, which we discussed a snapshot, the saroglitazar has been recommended for 1 year. The trials are going on long-term basis. And reversibility is linked to how much weight loss the patient has, how aggressively he is exercising, how aggressively he is following lifestyle changes. I've seen patients reversing fatty liver in 6 months also. So it is very variable, but generally it takes at least 6 months to 1 year to decrease the fat score and decrease the LSM. The patient takes medicines and exercises regularly and decreases weight. Then at least 6 months to 1 year is a time period where we can see changes in your fibrosis score on FibroScan.
Okay, sir. On behalf of NASH 24/7, I thank you for this lively and informative talk. And as you have been emphasizing the awareness for liver health and disease, it is also important for people affected by fatty liver to regularly visit the doctor and continue medications. With careful observation and precautions, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation. Stay connected with NASH 24/7 on Facebook and YouTube, and take care of yourself and your family members. Once again, I thank Dr. Amit for your wonderful session and informative talk, sir. Thank you.
Thank you.